Welcome back. October is Breast Cancer Awareness Month, and there's a new test available that helps you find out your risk for developing breast cancer. I'm joined now by Dr. John Shook from St. Luke's. Now, Dr. Shook, this test does not diagnose breast cancer, but it helps men and women understand their risk. Explain that.
Well, this is a predictive tool which helps the healthcare provider and also the woman to understand their risk for the development of breast cancer.
Okay, so here it is, BrevaGen. Tell us how it works. It's all about the DNA, right? It's not just a survey you're filling out to determine that risk. It's actually looking at your genetics.
Yeah, the exciting thing about this test is that historically we've used clinical history, personal history to help assess risk. There are some women, a small percentage, that do have a genetic mutation, but we don't know specifically a group of women that are at higher risk. So this test helps us assess those women, including some of their personal history, to give us a percentage or a risk score.
Now, this is a very new test. How long have you been using it?
I've been personally using it for about 2 months. It's been available about 6 months nationally.
So what have you found using it for 2 months? How has it helped women understand their risk?
Well, in the few people that I've used it, it has adjusted their score. Sometimes their score is adjusted to be a higher risk, sometimes it's a lower risk. So the anxiety in a negative test or a lesser test is even as important.
So do you think this will help save lives?
Well, there's no question that the way to save lives with breast cancer is early detection and preventive techniques. So if we can identify some of these women that are at higher risk, we can improve their management, their monitoring, and their surveillance. So yes, if we find early stage disease, their survival is incredibly better.
Is there certain people that you would recommend take this test?
Yeah, there's a questionnaire or a form that they would fill out after talking with their healthcare provider, and then we would assess their risk, and it's a very simple way of just swabbing the cheek and just getting some DNA material, and then we get the score back, and then they need some counseling on what the results of those scores mean. Okay,
when they get the results and their risk is high, then what do you do?
So in those patients that have a higher risk, we certainly monitor them more closely. We have preventive tools that we can also use. They'll have more frequent examinations. They'll have potentially more frequent imaging techniques and newer imaging techniques to monitor them for their risk in the future.
And we should say this is not just women who have a family history of breast cancer. This could help women that are 30 years old that could be at risk and don't know.
Yeah, actually the family history component may not even be as important. So there are a lot of other factors that if they meet that criteria, they could be tested, yes.
All right, well, thank you so much for coming on the show. Some great information. Exciting to see how this new test helps women and men fight breast cancer.
Thank you.